Short-term or long-term, moderate to severe pain. It works in the brain to change how your body feels and responds to pain.
Owino Sofia.
She's called Owino Sofia. She's 69 years. Where we are is called Ayere, Barapuo, Lira University. She started by having abdominal pain, backache, severe, and she started bleeding, and yet she had reached menopause. So she went to Lira Regional Hospital. She was admitted in the gynecological ward. Thereafter, a doctor came from Kampala called Dr. Kadu, who saw her. They took a biopsy. When the results came back, they told her to go to Mulago. They gave her 3 days only so that she should be able to reach Mulago. When she reached Mulago, they told her she was not going to be operated because the disease had spread so much, so they were going to put her for radiotherapy. Cancer of the uterus. She had a lot of backache, intestines, it had spread. So they did radiotherapy. She stayed in Mulago for 3 months. She was put on radiotherapy for 1 month, 1 week, 1 day. And she was discharged. She was sent back to Lira Hospital. The pain was too much and she had general weakness. Then Dr. Kadu sent her to me in palliative care unit. When they sent her, she was advised that I should talk to her because for him, he doesn't know the language which she was speaking. The doctor didn't know. When Philomena talked to her, then she was put on liquid morphine for pain relief. Philomena counseled her, and she was advised that since she was getting weaker, let her go and prepare her children. In case there is any in-law or any brother, somebody close to her, should talk to them so that they can help support her children because she was very weak. And then she was encouraged to have a will written. When she was talked to, she went to her home, went to Lira Court, and then she wrote a will. Then after doing all that, she started praying. When she's also continuing with palliative care services, more so taking liquid morphine. That was in 2007. When she started taking this medicine, the liquid morphine, and praying, she started seeing a change in her life. She would feel peace, no pain, and she would really sleep, and then the worries also disappeared. She wouldn't go to dig, she would not carry anything heavy because she had that problem with the back. And also the abdomen, there was a problem. Also, she had radiotherapy because of problems in the intestines.
How to use Morphine. Take this medication by mouth as directed by your doctor. You may take this drug with or without food. If you have nausea, it may help to take this drug with food. Ask your doctor about other ways to decrease nausea, such as lying down for 1 hour to 2 with as little head movement as possible. If you are using the liquid form of this medication, carefully measure the dose using a special measuring device or spoon. Do not use a household spoon because you may not get the correct dose. Ask your doctor if you're not sure how to check or measure the dose. The dosage is based on your medical condition and response to treatment. Do not increase your dose, take the medication more frequently, or take it for a longer time than prescribed. Properly stop the medication when so directed. If you have ongoing pain, such as due to cancer, your doctor may direct you to take long-term acting painkillers. In that case, this medication might be used for sudden breakthrough pain only as needed. Other pain relievers such as ibuprofen might also be prescribed with this medication. Ask your doctor about using morphine safely with other drugs.
Where
she was staying initially, there was problems, and she felt she wouldn't leave her children to continue staying in that confusion. So she really prayed so that she would sell off that piece of land. The clan members had refused her to sell off that land. She got a reply and then she sold off that land. So when she started selling that land, she fell and she had a fracture. In 2019 November. She continued with prayers. And so she got a revelation that she would buy land, she would build at least 10 doors, and those should use it for her upkeep. This is the land where we are. She also got another land where she can build a house for her children, a home, make a home. She has bought and she has already built the house. Then she also bought another piece of land for the upkeep of children in case the Lord calls her. She bought land in Kole in a place called Anyo Pida. Almost 5 acres. She continued with going for palliative care services, taking liquid morphine. She just sits like somebody who is not sick. When they are giving her, they give her more, senior patient. For her, she didn't get any problem at all. When she takes it, the pain goes away, she rests. So now she's saying when she takes the medicine, even the cancer cells get drunk. So all of them get drunk. So she doesn't even sit knowing that she's sick. Because now there's no pain. Now she sits and waits. When she starts feeling pain, she knows that the effect of the drug is getting off from her. So she knows she has to take. Then the pain also disappears. Then she just sits comfortably. She loves that medicine. She's thanking for the people for giving her that medicine. Because if it wasn't for that medicine, the pain would have killed her. She has never gone back to Mulago. She's for palliative care services. She has taken more than 5 years without going back to Mulago. Because there, after then, that problem of moving up and down. She couldn't get now the transport money. And then the doctors from Mulago were also asking, how is she looking after herself? Because she was an extraordinary patient there. And then the doctors also told her, those whom she had radiotherapy with all have passed on, but for her she's alive and they are wondering how she's still alive. She has not mixed any herbal medicine. She eats green vegetables. Green vegetables mostly. She doesn't like meat. She doesn't like fried food. Beans she doesn't like. More so she's depending on green vegetables. She takes the green one. There was a time they brought the pink one and it was too strong. So she didn't take it. So she uses that one, the green one, which is 5 milligrams per 5 meals. At the beginning, she used to take 2 meals after every 4 hours. And of course, you double the dose at night. Now she's taking 5 meals. They give her the measuring cup. So she takes 5 meals and then doubles the dose at night. When she gets pain, she's also trying to reduce on the frequency of taking because she sees the pain is not as bad as it used to be. Then for her, she takes it in the course of the day. When she feels that pain, she takes. Then night, she takes the double dose. Then she sleeps up to morning.
She checks
on her phone to see the time and then she takes her medicine.
Stopping medication. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. To prevent withdrawal, your doctor may lower your dose slowly. Tell your doctor right away if you have any withdrawal symptoms such as restlessness, mood changes like anxiety, trouble sleeping, thoughts of suicide, watering eyes, runny nose, nausea, diarrhea, sweating, muscle aches, or sudden changes in behavior. When this medication is used for a long time, it may not work as well. Talk with your doctor if this medication stops working well.
She says she did not have the knowledge. That knowledge got to her through me. I sat her down and taught her. When they sent her from Mulaga, I was in the hospital. So she got that knowledge and that empowerment from me. I am the one who opened her file in Lira Hospital. I would also tell her you don't have to wait for these drugs to get completely over. When there's still something in the bottle, come to the hospital to get a refill.
If you miss a dose, take it as soon as you can. If it is almost time for your next dose, take only that dose. Do not take double or extra doses. What to watch out for while using morphine? You may develop tolerance to the medicine. Tolerance means that you will need a higher dose of the medicine for pain relief. Tolerance is normal and is expected if you take this medicine for a long time. You might get drowsy or dizzy. Do not stand or sit up quickly, especially if you are an older patient. This reduces the risk of dizzy or fainting spells. Alcohol may interfere with the effect of this medicine. Avoid alcoholic drinks. This medicine will cause constipation. Try to have a bowel movement at least every 2 to 3 days. If you do not have a bowel movement for 3 days, call your doctor or healthcare professional. Your mouth may get dry. Chewing sugarless gum and drinking plenty of water may help. Contact your doctor if the problem does not go away or is severe.
She will go and speak of it very well. Because even in the gynecology ward when she was admitted, she used to go and teach people there, the women there. They used to fear that when you go for radiotherapy, you are good for death. Then she would tell them, you just see, she's the sample here. Me, I had radiotherapy in 2007, I am here. They are told her that she would live only for 5 years. Now it is 15 years. So for her, she goes there for them to see the example from her. 16 years, palliative care services. No problem. She's also happy that you came to visit her. She now sees it's God working. Even she was told when she reached Mulago that it's God who took her, she's coming back alive. And she came back alive when she was very weak. She's thanking you again. She's very happy to see you people. For you people to come and look for her up to her compound. Her village was in a very deep place, which was a nice, she didn't feel like building there. She got a lot of problems. She went and God gave her what to do. She also got the reply to the prayers she prayed. All these things she did when she already had a fracture. She wants to thank God and thanking people who gave her advice, who counseled her. She, at the beginning, she never thought she could have such a property. But when people talked to her, she also felt. For her now, when she was started on liquid morphine, then she went to God. All those fears, the worries disappeared. So she was empowered to start doing things. She also started doing a lot of things. She had to struggle very hard. When now the pain was not there, she was counseled, she was encouraged. That girl who went to do nursing, also she managed to pay school fees. Actually, she studied at Lira School of Nursing, and right now she's working in one of the hospitals here, Lira Pentecostal Hospital, LPC. That's where she's working. Those are the things she did when she fell sick, which she had not planned to do. Because I told her, do something for your children. This problem which you are having doesn't get healed. So she said when her head was only ringing, do something for the children, do something for the children, leave something for your children. And God gave to her. And what she has done now enough. It's the children to take over from her now. She's still thanking you people. She was thinking people had forgotten her. So that you come and look for her. Now she knows she's going to continue living on her own. Let God bless you mightily. Let God bless you so much. The blessings which no human being can give, let God pour unto you people. And please continue also visiting me. When you come to visit me, you empower me and you give me more strength. Thank you. I feel great. I feel honored. I feel blessed. I feel happy. Because when I reflect back on the first day I saw her, and then today, what more can I say? apart from thanking God. Can you imagine? She was telling you that for her she was preparing herself for death, but since 2007 she's here. What more can I say apart from having joy in my heart?
Having listened into Sofia's story, what makes you feel so sad out there? What makes you think when we talk about palliative care, you are going to die tomorrow? Isn't she very happy? You can see right from where she's seated. I think you have been able to also see what she's been able to achieve, much as she's been unwell for 15 years. One discipline she has learned, and one discipline I have seen that I get to appreciate, is her knowing her timetable and then adhering to her medication all through. Would like to thank all those who've been able to support Sofia and see her get through her treatment without defaulting very well. That is a discipline that I believe, irregardless of cancer or any other chronic illnesses, people should be able to pick up on, and you'll be able to live a happy and fruitful life.
Have waka, you bust the ice through me about my waka. Now come and see for yourself, see my waka that I got with Momo Nyabo. Jangola be waka, look at you waka, see my waka that I got with Momo Nyabo.
Show them waka! Simply deposit 20K or more on your mobile money for a chance to win 3 Toyota Succeeds and money to 2,000 lucky winners every week. We're giving away 24 cars and over 2 billion shillings of mobile money.
Leaders who care create a good learning environment.
Because a good school equals a better life.
Raising voices.
The Tales of Kasozi, brought to you by Uganda Communications Commission.
Yes, hello? This is Kasozi. How can I help you?
Calling you from the mobile service center.
Okay. So how can I help you?
Well, we have noticed a few things wrong with your number and need your mobile money PIN.
John Ferrer, never give out your password or PIN to any caller. Your mobile service provider will never call or ask for your personal details. If in doubt, go to your nearest phone service center.
This message is powered by UCC, MTN, Airtel, Bank of Uganda, and NPSP Association.
The Ministry of Public Service invites all ministries, departments, agencies, and the general public to the 11th Africa Public Service Day, APSD, scheduled to take place on the 22nd of June 2022 at Kololo Independence Grounds. The theme for this year's APSD is Bringing Citizens and Governments Closer, Service Delivery for Social Economic Transformation. The chief guest for the day will be the Right Honourable Prime Minister, Honourable Robina Nabanja. There will also be different exhibitions from the different ministries and agencies, and the public is encouraged to have a walk through to find out the services provided and the new innovations that have been put in place for efficient service delivery. Signed, the Permanent Secretary, Ministry of Public Service.
We bring you a fresh, well-researched program to help you identify opportunities for investment, job creation, growing your entrepreneurial skills, wealth creation, and social transformation. Create wealth, transform livelihoods. Every week we showcase opportunities for creating new products and services.